Hello, my name is Marta Reviriego Mendoza. I'm a medical science liaison based in Florida and a member of Sanofi's US Medical Affairs Rare Genetics team. Thank you for tuning in to the third episode of our US medical video podcast series, 9 minutes and 59 seconds, Science Talk for Fabry Disease. Today's podcast will explore the challenges experienced when monitoring pediatric patients with Fabry disease. Joining us today are Mr. Jerry Walter and Mrs. Dawn Laney. In addition to living with Fabry disease himself, Jerry Walter is the founder and president of the National Fabry Disease Foundation, or NFDF. Jerry will be representing the patient voice in the discussion, sharing insights and feedback that he has gathered from patients and parents in the Fabry community. Dawn Laney is an associate professor and genetic counselor at Emory University Medical Center in the Division of Medical Genetics. Dawn has almost 2 decades of experience managing the care of families affected by Fabry disease and coordinating clinical trials for patients with Fabry. She has authored 20 publications about Fabry disease, which has significantly impacted patient care both within the US and globally. Dawn is a member of the North American Fabry Disease Registry and is extremely active in the Fabry patient community. She is also the co-founder of Think Genetic, Inc., an organization which empowers patients searching for the genetic cause of medical challenges. We're delighted to have Jerry and Dawn with us. Let us get started. Hi, Jerry, and welcome to the podcast. Thank you for being part of today's conversation. Jerry Walter, as we can both appreciate, learning that one's son or daughter has Fabry disease can be a scary and difficult diagnosis for a parent to hear. Speaking for the Fabry patient community, what do parents of children with classic Fabry disease understand about Fabry organ involvement and the potential for disease progression to begin in early childhood?
Thanks, Marta. It's a pleasure to be here. As the president of the National Fabry Disease Foundation, otherwise known as the NFDF, our communications with parents enable us to get a sense of what they understand about organ disease progression. When we think about organ disease progression, we think about the major organs, the heart, the kidneys, the lung, and the brains, rather than all of the other symptoms that can affect the health of a person with Fabry disease. We learn what parents understand through Fabry community Facebook group discussions, responses to NFDF surveys, and discussions with parents. The NFDF is in contact with about 1,600 adults with Fabry disease among 2,500 newsletter subscribers and over 4,500 Facebook community members. Our survey participants come from segments of all these groups. For clarification, all of my comments in this discussion relate to parents who have children with classic Fabry disease. We find that most parents' initial understanding of Fabry disease comes from their own family's experiences. Then they learn from healthcare providers, education programs from organizations like ours, industry education programs, and talking with other parents. All of these education sources are important, especially when a family does not have access to a healthcare provider experienced with Fabry disease. For kidney disease progression, most parents know that proteinuria is one of the earliest signs of kidney dysfunction. Feedback from parents indicates that most children have an annual checkup with their healthcare provider that includes a test for proteinuria. Other than testing for proteinuria, parents are unsure about other indications of early kidney disease. Feedback from parents about monitoring for early signs of heart disease indicate that parents ensure that their kids get EKGs and echocardiograms. One of the NFDF surveys indicated about 50% of kids get their cardiac scans. Many parents have a good idea about the early heart disease symptoms in adults, but are unsure about early heart disease progression in children. We've learned that a minority of children have completed their cardiac MRIs according to published recommendations. Disease progression in the brain is a frequent topic in discussion forums because of the occurrence of transient ischemic attacks and strokes and white matter lesions seen on brain scans in adults. Unlike monitoring for kidney and heart disease, monitoring and managing stroke risk is less well understood by parents. Other than taking blood thinners and antiarrhythmia medications, parents' understanding of managing stroke risk varies and is not on most parents' radar for their children. Most parents don't consider brain involvement or stroke risk in their children. and brain MRIs are not recommended for kids according to the schedule of recommended assessments for kids. Lung disease caused by Fabry seems to get the least attention from parents among other major organs, except for people with abnormal lung function tests. Feedback from parents indicates completion of lung function tests by adults is sporadic and almost non-existent for children. That makes sense because lung function tests are not recommended for kids like they are for adults. Parents' understanding of disease progression varies greatly depending on the length of time since their first family was diagnosed, whether they have knowledgeable healthcare providers, their family members' disease manifestations, their interest in learning, and their access to educational resources. No two families are alike.
Thank you so much, Jerry. Your insights from families in the Fabry community really help shine a light on parents' understanding of organ involvement in childhood. It's a lot for families to take in. Could you speak a little bit about the challenges parents must overcome in order to prioritize early disease assessments and monitoring for their children with Fabry disease?
Parents report the top challenges they face are finding knowledgeable and adherent healthcare providers, driving long distance to appointments for assessments and monitoring, and taking so much time away from school for children and work for adults. By adherent healthcare providers, I mean providers that agree with the published schedule of assessments for children and provide timely authorizations. Many parents tell us they must take the initiative to make appointments for recommended assessments. Children's providers don't always help or initiate scheduling assessments. The relationship between patients and providers varies greatly. Many parents provide glowing reports about the providers and their care. Other challenges mentioned by parents are cost of labs and scans and procedures, a lack of guidance about recommended assessments, and children's resistance to so many healthcare appointments. For parents to successfully prioritize necessary assessments and monitoring for their children, they require access to knowledgeable healthcare providers who advise them appropriately and facilitate their appointments. And they must have access to medical facilities within a reasonable distance of their home.
Thank you so much, Jerry. We really appreciate you sharing these insights from the Fabry community and helping our listeners better understand the needs of parents with children affected by Fabry disease. Hi, Dawn. Thank you for joining us today. You've heard Jerry speak about families' perceptions and understanding of organ involvement in children with classic Fabry disease, as well as the challenges that families encounter when prioritizing their children's health. Based on your clinical experience, how early do Fabry disease-specific symptoms and organ involvement begin in children with classic Fabry disease?
Thank you, Marta. I appreciate you having me on the podcast. Fabry-specific symptoms in boys and girls with classic Fabry disease begin much earlier than you would expect. From my clinical work, talking to parents of kids living with Fabry disease, and my longitudinal research, I've learned that symptoms start around age 2 to 3 with abdominal bloating, chronic loose stools, heat and cold intolerance, and gradually decreasing ability to sweat. What parents and children refer to as the hot feet appear with exercise or illness usually. The stories parents tell about very young children holding their cold water bottle to their feet or sitting down after running around the couch to hold their feet for a bit and then hopping up to run again are very consistent. Also telling is the way that symptoms progress in a very specific pattern through childhood. This includes the gastrointestinal progression from chronic diarrhea and bloating to chronic abdominal pain around age 3 to alternating constipation and diarrhea around age 4, and then adding in episodes of severe, intense abdominal pain that can last more than 2 hours, and that starts around age 5 to 6. Similarly, we have progression from normal sweating at birth to decreased sweating and then absent sweating by age 4 or 5 years of age. We also have the changes from just having hot feet when they're 2 to 3 years old to occasional episodes of burning pain in the hands and feet, maybe when they're hot or have a fever, to chronic daily burning pain that starts around age 5 to 7 years. When you think about very early organ involvement, the way to learn more about the symptoms changes from subjective reports from parents and children to objective tests like EKGs examining the rhythm of the heart and the function of the kidney versus blood and urine tests. There's a great paper from the Cincinnati Children's Hospital Medical Center that told us that bradycardia can be detected using EKG under age 18 in 23% of children with Fabry disease. From the kidney perspective, microalbuminuria appears in the urine of pediatric patients, and then proteinuria has been detected in children under 10 years of age. Having said that, we do know that in a small group of children aged 7 to 18 years of age, there were large amounts of abnormal glycoprotein storage in the kidneys before there's any abnormal renal, blood, or urine tests.
Thank you, Dawn. It's really helpful to hear you describe the symptoms reported by parents of very young children. In your opinion, how can physicians most effectively engage with parents and broader Fabry community about the importance of regular monitoring for their children with Fabry disease?
Engaging parents and the community about the importance of monitoring for early signs of Fabry disease is really dependent on learning how best for providers to elicit and hear information from family members and parents. Families need to feel that they're participating as partners. The partnership involves education from the provider about what to look for, but also the reasoning or importance behind tracking symptoms. Explaining the why and establishing the provider as a medical ally really goes a long way.
Thank you, Dawn, and thank you again, Jerry. We really appreciate all that you have shared with us today. Jerry, for giving us insights into families' understanding of early organ involvement in their children with Fabry disease and the challenges that parents face as they manage their children's health. And Dawn, for helping us appreciate the earliest signs and symptoms in children with classic Fabry disease. And to our listeners, I'll close with questions for our audience. How do you engage parents of children with classic Fabry disease? Do the families in your care understand and appreciate the potential of early organ involvement? How do you partner with parents to encourage appropriate monitoring for their children? Thank you for tuning in into today's video podcast, and please join us again soon for our next installment of 9 minutes, 59 seconds Science Talk for Fabry disease. Thank you.